So welcome everyone. I know there are still people joining, but we will get started. It's my great honor as Chancellor here at UCSF to host this session this afternoon to celebrate the remarkable tenure and leadership of Mark Laret, our President and CEO. He has held that role for 21 years, and he unquestionably leaves UCSF in a far, far better place than when he first joined us 21 years ago. I've personally had the pleasure of serving on the search committee that brought Mark to UCSF from UC Irvine those many years ago, and have worked with him in a number of capacities, first as a division chief, and then as a department chair, then as a dean of the School of Medicine, and most recently as chancellor. And I can say that it has been an absolutely wonderful partnership. I have learned a tremendous amount about what being a great leader looks like, what it means to turn up every day and push the organization further, what it means to be a leader on good days, and what it means to be a leader on great days. Mark has definitely transformed UCSF and has created a foundation that the next leader of UCSF Health can build on to take us to the next level. Just a couple of personal reminiscences before we start into the program. You know, I have learned over many years that there are a number of attributes that describe good leadership. And for me, the bedrock of strong leadership are really three things. One, intellectual honesty. An ability to look at issues as they're presented, not sugarcoat them, not look through them, but take them on with full intellectual honesty. The second is organizational values, the ability to define what the values of an organization are, in this case, UCSF, and to make sure that every decision that is made, not only by the CEO and president, but by the entire leadership team, is taken in conjunction with those values. And as you know, Mark brought the Pride values to UCSF very early on in his tenure. And we have tried to live up to the Pride values in the work every single one of us does every single day. And then the third is communication. It's hard to be a strong leader unless you're a good communicator. And Mark is just a wonderful communicator, both verbally and in writing. And he does so by distilling things down to the core so that it's easy to understand what we're all trying to achieve and how we're all working together for the betterment of our patients and for the betterment of the mission that UCSF is involved with. So Mark, I personally thank you for our partnership over 21 years, for your leadership of UCSF throughout that period of time. And I think you can be extraordinarily proud of where you are leaving UCSF in terms of what we are able to provide the individual patient who comes through our doors every single day, but also what we're able to provide our community here in the Bay Area, in the state of California, in the country, and around the world. You are a recognized leader of healthcare throughout the world, and we thank you for everything that you have done for the last 21 years. I would now like to introduce a video that captures some thoughts and comments from people that Mark has worked with over 21 years, and then we'll follow that with some more program. And I want to assure you all who have joined us, you will get plenty of time to hear from Mark later in the program. So let's now play the video. When former UCSF Chancellor Mike Bishop hired Mark Laret 21 years ago, he could never have imagined how one person could make such a difference at an organization. But we have all witnessed how Mark's leadership and vision have completely transformed UCSF Health.
This is my last trip through to just say thank you for what you do every day. Thank you for being here.
What's up, fella?
How you doing, guys?
I mean, you cutting out.
I'm cutting out.
Can I have your job?
Yeah.
We needed to recruit urgently a hospital director. People don't realize what a state of disrepair UCSF was coming out of the demerger with Stanford.
We were at probably the darkest days in UCSF health history.
I called him and I think I persuaded him to come. That's the best thing I've done for UCSF.
I met Mark the very first day he started. The merger had ended. Everyone was either angry or confused or what was going to happen. And so here comes this guy who nobody really knows. And he came in and he was just from the very beginning, that very moment, the warmth and the empathy for what people had gone through. And he was very self-effacing and humorous and talked about his kids and his family. And it was a moment where I think people sort of settled down and said, okay, we now have someone who is going to lead us.
With his leadership, changing all of the leadership, he turned it around. Looking at it today, it's almost hard to believe how far we've come.
You know, you can think about UCSF being a ship. It's a really big ship, and to get the ship to turn in a relatively short period of time, that takes a good captain.
Our goal today is to update you on the progress. I think
He literally was a change agent. We needed a change agent at the time, and Mark brought all of the attributes of great leadership. He brought very strong values, introduced to the entire organization what we now call our pride values: professionalism, respect, integrity, diversity, and excellence. That's been a roadmap for us for the last 21 years, and I think one of Mark's great legacies.
Thank you so much.
Nice to meet you.
Thank you.
He is not afraid of the challenge. Just the example of building the new hospital campus at Mission Bay, he reminds us, and I think he's absolutely right, we did it without knowing how we were going to do it, but we made a commitment to do it. We found the resources, we built it, and it's probably better than we could have anticipated that it would be. And so I think that's the kind of optimism and resilience and grit that Mark shows.
today we celebrate champions.
The other thing that Mark did is to develop an advisory group of our best donors and cultivate them. And I think that's a major contribution.
I think Mark is always there to do whatever is necessary. He inspires great affection and loyalty on every level. He and Sam, they just instill so much confidence that people want to give.
The affiliate program is a leap forward in terms of care in the Bay Area.
For us to thrive and for us to have the greatest positive impact on the health of the Bay Area community that we serve, we needed to go from being a hospital on the hill to a larger system of healthcare throughout the Bay Area.
The thing about Mark is he brings people together around a theme, around a cause, around a vision for the future, and he does it very well. And he does it authentically. You just feel it when you're with Mark.
This is a better picture. Who's that old guy?
Around about 2013, it became evident to us and to the leadership and the board of Children's Hospital Oakland that they were facing pretty daunting financial picture. We had a choice. Did we want to get in there and help them, knowing that it would be a fiscal challenge for us and not an easy challenge to affiliate with them and bring them into the UCSF family? But I would say Mark did not hesitate. And now 7 years later, it's been confirmed that it absolutely was the right decision, and I couldn't be prouder that we took that risk.
Good to see you.
We've seen your purses
Hi, Mark.
when we
You
went to Navajo Nation. Yeah.
Oh, you did?
Yeah.
Oh my gosh, thank you so much for that.
Thank you for making it possible.
UCSF and CPMC were the cornerstones of the support for the African American Health Disparity Project. I came on the project in 2007. Mark was continuously my yes guy. I knew that I can go to him and say, Mark, I need X, Y, and Z, and he would help me get it. Disparities were not necessarily at that time at the forefront of people's thoughts. We now talk about Black Lives Matter. Well, we were talking about that as a part of the Disparity Project. That was, 2007. When there was debate and when there was concern about whether or not the hospitals could afford this and whether this was the right thing to do, Marcus Laret's voice was huge. So all of the progress that we've made is directly attributable to Mark's vision, to his support, and for his continued concern to make things better for everyone. The ripple effect of his work will continue on well after his tenure.
Mark Laret made a huge difference in LGBT, lesbian, gay, bisexual, transgender healthcare all over this country. I was the very first director of the LGBT Center. So I went to meet Mark Laret, really shaking in my boots because I didn't know him yet. I think we were scheduled probably for, 7.5 minutes. We spent over an hour with him. And it was totally clear to me that this man was real. He was open. He was present. He was listening. And he really got what I was saying about what LGBT patients were facing. And he cared instantly. And he said, we will do what it takes. And we became the first med center in the country to really attend to LGBT patients. We looked at every best practice and policy we could think of. Mark was behind me all the way. And what we did was we took the UCSF policies and practices and we made them into a really comprehensive self-assessment that any hospital could take. The HEI now has over half the nation's hospitals, and that simply couldn't have happened without Mark Laret.
Thank you, Fran. Thank you so much. Appreciate it. Thank you. That's what I need is cupcakes with my picture on it.
He's such a wonderful guy. He's so, friendly, and I think his heart's in the right place, which is really important, in a CEO.
There's not a meeting I've had with him where we don't crack up or laugh in some way. And I will miss that because not everybody appreciates that, the need for laughter or the need for just being able to just be yourself and be safe in an environment. And I think he's always afforded me that.
He would always say hello. And I thought, that's amazing. He might not know who I am or what I do or what my name is, but he made it a point to always look at you and just say hello. Make that contact. And that's really important.
How many years have you been here, Shelley?
26. Thank you so
much. You didn't prepare me for this.
Yay! Thank you so much.
Thank you so much.
Always willing to disagree, but never being disagreeable is something that I've really appreciated about working with Mark. It's a very difficult job with a very turbulent sort of landscape. And I can remember examples where I was on one side of the room and Mark was on the other side of the room, and we would have a debate. And the faculty and staff would be looking at us like we were in this big fight. And then it would be over and Mark and I would go and sit at the same table and start joking around and talking. And I think that's one of the greatness of Mark is his willingness to have that open, honest, hard discussion.
I think there's always the one phrase that it will always stick to me. What would Mark say? And he would always say, do the right thing and what's right for the patient.
It was his work ethic, his optimism, his leadership style, his ability to attract people made him probably one of the #1 health executives in the country.
Thank you so much. Thank you for all that you've done.
When I think of Mark, I generally think not just one word, but to use one word, I will say that he is optimistic.
Real.
Inclusive.
Visionary.
Extraordinary.
Strong.
Authentic.
Optimistic.
I'll ask you just to rewind for 10 or 20 years and then fast forward without Mark in the picture, and healthcare in the Bay Area would be different and the quality of life would not be as good. He's a man who has just made an enormous difference.
Mark has been a great leader for UCSF from the day he arrived, literally, and his legacy will remain after him. So I think much of what he has done for the organization will be foundational for how we continue into the future. So yes, one person can make a difference.
I look forward to seeing you at the Warriors game. Thank you, Mark.
Thank you, Mark. Thank you, Mark. Thank you, Mark. Thanks, Mark.
Thanks, Mark.
Thank you, 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 Mark.
Thanks, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark. Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thanks, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you, Mark.
Thank you.
Thank you so much.
Well, I hope you all agree that that video captures Mark so well, both as a leader, but also as a person. I'm now delighted to introduce Francesca Vega, our Vice Chancellor for Community and Government Relations, who's going to share some words from elected officials that have been touched by Mark's leadership, and I think reflects that his influence goes way beyond UCSF and deeply, deeply into our communities. So Francesca.
Thank you, Chancellor Hagood. I want to take this moment to acknowledge how critical Mark's leadership has been to our relationships with elected officials and key policymakers throughout the years. This being said, our elected officials at the local, state, and federal levels have taken this opportunity of Mark's retirement to honor his amazing work during his tenure at UCSF. We will have a special guest, but I don't believe that she has made it yet. So it is my pleasure to read the proclamation from the City and County of San Francisco that Mayor London Breed has prepared for Mark. Whereas the City and County of San Francisco traditionally recognizes individuals who have made significant and remarkable contributions to the vitality of our city, the dedicated and meaningful work of Mark Laret truly represents San Francisco values at their best. And whereas a nationally recognized leader in healthcare, Mark joined University of California, San Francisco in 2000. Under his leadership, a new medical center executive team was recruited, guided by a value system he implemented called PRIDE: professionalism, respect, integrity, diversity, and excellence, which has since been adopted across the entire university. And whereas with an emphasis on quality of patient care, safety, positive patient experiences, deep employee engagement, and operational efficiency and health equity, Mark's direction soon cemented UCSF Medical Center status as a nationally renowned hospital. And whereas in recent years, through major capital projects, as well as affiliations and partnerships throughout the Bay Area, UCSF Medical Center has become the anchor of an important regional health system known as UCSF Health. And whereas during his tenure, Mark has propelled the dramatic growth of UCSF's clinical enterprise, which now serves twice as many inpatients and nearly 5 times as many outpatients as in 2000. UCSF's health workforce has more than tripled while observing financial stability. Mark has maintained a strong commitment to UCSF's public mission and its duty to provide the highest level of care to medically underserved communities. And whereas because of this commitment, UCSF Medical Center at Mission Bay, which includes UCSF Benioff Children's Hospital, San Francisco, Baker Cancer Hospital, Betty Irene Moore Women's Hospital, and the Ron Conway Family Gateway Medical Building provides the highest level of care to patients of all ages from throughout the Bay Area. And whereas, I'm almost there, and whereas Mark is embarking on another exciting chapter of his life as he retires after over 2 decades of serving our community at UCSF with optimism, respect, principles, humility, and humor. Now, therefore, be it resolved that I, the Mayor, London N. Breed, Mayor of the City and County of San Francisco, do hereby proclaim December 1st as Mark Laret Day in San Francisco. Congratulations, Mark. And I now want to take the opportunity to introduce the Honorable Jackie Spear, who represents the 14th Congressional District and had some words for you on this special occasion. Congresswoman Spear.
Thank you, Mark. I am actually talking to you from the women's reading room off the House floor because we're in the middle of votes. But I'm sitting on the couch that John Quincy Adams died on. for what it's worth. Anyway, I wanted to join everyone else in saying what a remarkable career. How lucky we have been to have you at the helm of this institution for so long, to provide the jewel that we now boast about at Mission Bay, and the remake of Parnassus in the making. And it's all due to just remarkable leadership on your part. When I think of you, I think of someone who is unflappable. You always appear to me to be unflappable, no matter what the issue was. In the aftermath of the merger with Stanford, you took the reins of leadership and helped build the institution that we're so proud of today. I'm proud to get my healthcare at UCSF, as I know so many of our community leaders and residents are as well. So I just want to say to you, with that beautiful smile of yours, I'm just going to read one part of the congressional record submission that I have made into the congressional record for all to read for time immortal. But I want to read you this last paragraph. From a small research and treatment campus on a hill and a few isolated campuses elsewhere, to a bustling regional powerhouse and global standards setter, UCSF Health prospered tremendously under the tenure of Mark Laret. After 21 years at the helm of this prestigious healthcare institution, it's now time to say goodbye to a historic leader. Let it be known that a humanitarian is retiring, who can now spend more of his time with his beloved wife, Janet Laret, and their son, Parker, and daughter, Casey. His duty having been accomplished with grace, his rest is justly earned. I know you're not going to be resting, but I look forward to observing you in your next chapter. And since we're both leaving soon, we'll have time to have lunch and talk about the good old days and the good new days as well. So congratulations, Mark. Love you.
Thank you. Thank you, Jackie. So touching. Thank you so much.
Thank you, Congressmember Spear, and thank you for being such a champion for UCSF. I would now like to introduce a video acknowledgement from our state senator, Scott Wiener, and then we will go to Cynthia Curapa, our Mark Laret's chief of staff. Thank you.
Hi, I'm Scott Wiener. I have the honor of representing San Francisco and Northern San Mateo County in the California State Senate, and that means I have the honor of representing UCSF. And I want to really just from the bottom of my heart thank Mark Laret for his incredible service to our community and to UCSF. Mark, you have played such a critical role in the modernization and expansion of UCSF and its ability to provide life-saving healthcare, not just to San Franciscans, but to people from around the Bay Area, the state, the country, the world. We are all so proud of UCSF here in San Francisco for obvious reasons. And Mark, you played a critical role in making us even more proud. So it's a loss in your retirement, but I know you're not going far. Your legacy will last for a very, very long time, and I know that you'll continue to be involved in making sure that this amazing institution continues to thrive. So thank you and congratulations.
Great. Mark, how are you holding up?
Not terribly well. Yesterday we had a managers meeting and I introduced this rag that I keep nearby. That was an incredibly touching video, and I'm deeply appreciative. Thank you.
Well, I just want to start by telling you what an honor it's been for me to be your chief of staff during the last third of your tenure. I really feel so honored to have had a front row seat witnessing your leadership in action, and learned so much from you. I'm really going to miss you. Okay, we're going to get on to this next part of the program. And first, I want to remind our viewers that each person can send you a personal farewell message. So we've set up a special area of the recognized platform, and we've set it up in such a way that people can share a memory, say a farewell, upload a photograph if they have one to share. And please do this by December 31st, and then we'll make a nice keepsake for Mark with this collection of messages. So the next part of our program, we reached out, Mark, to the organization at large, asking people, what do they want to hear from you? And what questions might they have? And we're not able to, we don't have enough time for all of them, but I've tried to categorize them into buckets. And so the first one came from Lee Jun Ma from Radiation Oncology, who wrote, thank you, Mark, for your leadership over the years. In your opinion, what are the key challenges and opportunities for the U.S. healthcare?
Well, there are plenty, to be sure. I think there's always this tension between the cost of healthcare and the desire at the federal level and at the state level to reduce the cost of healthcare. Employers want to reduce the cost of healthcare, and the desire that we have as providers to increase access to healthcare and have more people get access to it. So I think that's a fundamental tension that we're always going to have to address. I personally think the single biggest challenge facing the healthcare system in this country is health inequities. It was referenced in the video, but it's just shameful that in 2021 that there's still measurable differences in the health outcomes and health services available to people based on race or ethnicity or sexual orientation, gender identification, any number of other variables. And I think this is the huge challenge. In terms of opportunities, I'll say it once, I'll say it 1,000 times. I think this is a place where UCSF can lead. Our voice is highly respected around the country, in Congress, in our associations, and people are looking at what we do here. So as we take leadership in reducing health inequities, as we take leadership in finding new ways to deliver care at lower cost, I think others will pay attention. So there's still plenty of work to do on the agenda.
The next questions came, they're all kind of the same flavor. Jen Wilson from marketing, Kavi Reddy for the Center for Reproductive Health, Aaron Nevat from facilities management. And they're kind of asking this question of, what memory of your time at UCSF do you think will stay with you the longest? What do you consider your greatest success or your most prized accomplishment?
Well, over a couple decades, there's so many great memories of, just how we became stable coming out of that, the failed merger with Stanford, building the new hospital, Mission Bay. Clearly, building this regional network is something I'll be very, think back fondly about. But I think the thing that I get most excited about and am proudest of is how UCSF has reached out into the community. So Chancellor Hoggood referenced the decision that he was absolutely intimately a driver of, was bringing Children's Hospital Oakland into the UCSF family. And not because we thought we were going to make money, but because we knew it was the right thing to do. And moments like that make me so proud. When we broke ground just recently for a new cancer center at John Muir Health, we're going to open a Warm Springs outpatient center with Washington Hospital. All those things make me proud. But I'll just say two things that, of all the memories, are going to stick with me the longest. The first is when Ebola struck, and the consequences of catching Ebola were clearly extremely severe. We built an Ebola unit at Mount Zion in case we had Ebola patients. a number of staff said, I volunteer to work in that unit. And when COVID broke out and the very first case in San Francisco, in California was identified, it happened here in the Bay Area, and several hospitals said, no, thank you. We're not really prepared to take that patient. We took that patient, and we had staff who said, I volunteer to work in that unit. And then when COVID flared up at New York City and the Navajo Nation, we had teams of people saying, I want to go. And that was before we knew what the risks were. That was before we fully understood the transmissibility of it. But we just knew other people were suffering. And what I will always recall as the greatest reflection of the character of this organization is people, when there's a hard time, when there's challenges, when there's a need, it's our people who say, I'll go, I'll do it. And that was something I will always cherish.
So Emmer Braddock from the Revenue Cycle was asking about reflecting on your efforts to promote diversity, equity, and inclusion. Which program, policy, or cultural change that you've championed specifically in this area makes you feel most proud, and how can we continue your legacy of prioritizing this critical work?
Well, that video was very flattering, seeing Michael Huff and the work we did on African American health disparity, and seeing Shane Snowden and the incredible work she's done here and nationally on LGBTQ issues. I appreciate the compliments, but I think they're overstated. What I did was to try to create an avenue so that we could always be putting these issues front and center in the organization. But I realized how little I had done, to be honest, when George Floyd happened. And his murder just reflected something so deep. And I recall talking to Sheila Antrim and trying to get a better understanding of the Black experience in this country, because I worked so closely with so many Black and colleagues, just talking about race for a moment. And I realized I didn't really understand it. And out of that, Sheila asked me to speak to a number of people, and I listened to the experience of driving while Black and being followed when you're in a department store, and just that extra pressure of having to be present and fearing that any interaction with the police could be your last. I mean, I didn't understand that. I really didn't. So I guess, yes, I'm proud of some of the things we've done at UCSF Health. I'm really proud of what UCSF has done overall. Renee Navarro's leadership has been absolutely fantastic. But I guess I would just say my ask of everyone here is to listen and to learn, be open, learn from each other, and particularly people who've had a harder set of experiences. When Dean King told me that when he was a young, a student in school and growing up in the South, and his friends went one way to go to school and he had to go another way to go to school, that's when I realized I need to learn a lot more. So it's still a work in progress for me, and I hope that it will be for all of you, so that we can eliminate health disparities in this country.
Thank you. We had a couple of questions from Maria Deers in risk management and Linda Patch and the clinical systems PMO, and they have to do with advice. What advice would you give a young professional who wants to remain as an employee at UCSF until they retire? And if time travel were possible, what are the top 2 or 3 pieces of advice you would give your younger self?
Well, I think for anyone who works at the University of California or certainly at this campus, you are just in for such a tremendous opportunity to learn from other people. You know, that the quote on that video started with Mike Bishop, who hired me, who's a Nobel laureate. I mean, how often do you get a chance to work with Nobel laureates? But if you work at UCSF, you do. But it doesn't have to be Nobel laureates. It can be people who have other jobs that maybe you think you might be interested in someday. So my main recommendation for building your career is to learn from each other, take advantages of the growth opportunities, the education opportunities that are here, and you'll move forward. As I think about that, the second part of your question, Cynthia, what advice would I give my younger person? There's probably so much, but in the end, so much success happens because of people following things they were probably taught as a child. To be honest, to work hard, to be reliable, to follow through when you make a commitment, to do the right thing even when no one's looking. I have seen over the course of my career, a lot of people's careers go sideways because they got caught up in the title or the money or the something else along the way. And what I've so appreciated about UCSF is this is an organization that values good values. And I think that's something that I didn't fully appreciate when I was in my 20s or 30s, that those values are the thing that will distinguish people who are going to succeed and those who aren't. And maybe one other thing is that so often we think about how we get measured, what is our personal scorecard. And yet you realize that in any organization doing anything of consequence, it's all about teams and it's all about working with other people. And so I just encourage every one of you, when you're on a team, be the best team member that anyone's ever seen. Jump in, take on a little more work than somebody else, drive the agenda as much as you can, just help that team be successful. And if you become a team member, be the best team leader, be the best team leader that you can possibly be. And that's give everyone a chance to succeed, give everyone a chance to grow and learn, and spread all the credit around. Because I think teamwork is underappreciated or undervalued, and yet it's the only way we accomplish anything in an organization as big as this.
So tell us, what are you going to do when you retire? What's next for you?
Well, I've told everybody right at the top of my list, and it was reinforced when I saw the video, that I want to lose weight. That's I can blame it on the job, but I won't have that to blame afterwards. But I've always had I shouldn't say always, but my real passion is in healthcare is to look for things that can improve the quality of patient care, the safety of patient care, the patient experience, the provider experience, and do it at lower cost. Because I think that's where the premium is going to be in coming decades, is how do we make this system better and more affordable? So I'm engaged with a few boards right now. I'll be involved with a few more after I leave the university, ranging from Blue Cross Blue Shield of Arizona, where I'm learning a little bit about the other side of the coin, to some medical technology companies. And I hope to be involved with some think tanks looking at issues around service to the underserved. As I said, I think that's the single biggest issue. And so I'll be doing that. And then what I won't be doing is worrying about next year's operating budget or the next Joint Commission survey, but I guarantee you I'll be watching from the sideline rooting this organization on.
So what are your, we carved out some time for your closing reflections. And so this is your time to just share your thoughts.
Well, this is, I guess, if I ever had a chance to unload and air all my grievances, this would be it. I don't think it would take Chancellor Hoggood too long to fire me at this point to make it worthwhile. So I won't go there. But let me just say a couple things, bits of advice, and then some thank yous. The bits of advice is, UCSF is an amazing organization with amazing people. As I mentioned, I was hired by Chancellor Mike Bishop, who's, just one of the most complete, intellectually brilliant people I've ever met. And Haile DeBass, who you saw in that video, who was the dean here, and then the chancellor, and then the dean. And when he called and said, let's be partners, there was no way I was ever going to say no to him. An incredible human being. And, to this day, Chancellor Hoggood has been the best partner I've ever had in my working career, and the best person I've ever worked for. He fully understands not only the business that we have, but the science, the academic missions, the public service missions. UCSF's incredibly fortunate to have him. And then I could go on and on. I mean, our faculty, our department chairs are spectacular. We're just hearing that there was a press conference earlier today where Charles Chu, one of our faculty members, sequenced the first Omicron COVID patient here in the Bay Area. That happens at UCSF. So the talent here is unbelievable. And I just have to say, I'm so deeply grateful to this environment. But let me just put a few challenges out for this organization. I referenced it a little bit earlier, but the country is looking to UCSF. Yes, the Harvard hospitals get attention. Yes, Johns Hopkins gets attention. But there's a real desire to hear from UCSF. And I knew this coming to UCSF because I'd been at UCLA, where people pay pretty good attention to you at UCLA. I went to UC Irvine, and they didn't pay so much attention to what I had to say. But when I came to UCSF, people pay very strong attention because they know that this place is going to be at the forefront. So I encourage you to take on big issues. We've taken on some big ones in the past. There's big ones coming, like building the new Helen Diller Medical Center at Parnassus Heights, the new research and academic building that's going to be built, the new Benioff Children's Hospital, Oakland Hospital facility, all the affiliations in the region. Those are all terrific, and those are big, and they will take a lot of work. But I encourage UCSF to think even bigger. What are the kinds of things that in 10 years or in 20 years you would say, wow, I'm so glad that we took that issue on. Health equity might be it. Maybe there's others. But I'm so glad we took it on in such a powerful and meaningful way. Chancellor Hoggood and I were heavily involved in the fundraising for the Mission Bay Hospital project, and then he's gone on to be the best fundraiser for probably any university, any place, certainly in the UC system. And I remember when we were early on raising money for the Mission Bay Hospital, one of our donors, Chuck Feeney, who was essentially the founder of Duty Free Shops, said to me, Mark, people don't give money in proportion to the size of your need. They give money in proportion to the size of your vision. And that was a moment that really stuck with me, and I know it stuck with Chancellor Hoggood, that if we're just talking about building a new hospital, okay, there's a lot of hospitals that need to be built. But if you're talking about doing something that's going to transform healthcare, transform care for that child who was born on the streets, homeless, in Oakland. If you're going to transform behavioral health, those are things that attract people who have big ambitions and are prepared to make big philanthropic gifts and support. So I just encourage you to think big. As Dean King said, resources follow the big ideas. And I think that's where UCSF will succeed in the long run. I will have a successor. I know Chancellor Hoggett is working on that, and I'm sure there'll be an announcement shortly. But I just ask all of you to give my successor the same support, engagement, belief that you've all given me. It's been, I say, just a profound honor. So yesterday I cried when I got to this point with my managers, and I told myself I wasn't going to do it today, but I'll cry anyway. What the heck? I cry not because of sadness, but because of gratitude. I'm just deeply touched at what all of you do every day for others. And it's been an incredible pleasure and a privilege to be associated with you. Thank you.
Thank you, Mark. I think your words say it all, and don't really require any closing comments from me, other than I've been watching the comments come in, and everyone has an intense sense of gratitude for what you've brought to the organization. So thank you. You are right. I will be naming a successor soon. I'm excited by the choice. I can't share it yet because it requires regential approval, which I will be seeking in January. I'm very confident of their strong support. And I look forward to working with your successor, building on the tremendous foundation that you have created for us all, and to continue to live by the values that you have so deeply entrenched in the organization. I will end this afternoon, although it looks like there's lots and lots of comments coming in, by just quoting what is a well-known quote, frequently used, but I think really captures what we're trying to express to you today. It comes from Maya Angelou, and she said, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." I, for one, won't forget what you said or what you did, but we will all never forget how you made us feel in this journey over the last 21 years. So thank you. I would remind you that you're working until December 31st, but it's been a true privilege for me to host this session this afternoon. I thank Cynthia and her team for putting it together. And Mark, thank you again on behalf of all 33,000 people who work at UCSF, and for countless thousands who have benefited from the leadership that you have brought to the organization. We'll finish off strong this month. I know there's a few things we have to accomplish together, but for now, thank you, and thank everyone who've joined us this afternoon for this celebration and tribute to Mark. Thank you.
Thank you all.